they're still going to be able to have annual monetary limits on the amount of care you can get. So if you have a health problem that is very expensive in their parlance, there will be limits on how much they'll pay. It could be $1 million, it could be different amounts. On their checklist was to kill the public option. That died, right? It was interesting to watch that go down. It went, well, we like to call it the incredible shrinking public option. It went from robust to what Paul Krugman called medium strength, and then now we could call it 100% decaffeinated, I think. It's not going to be in the final legislation, or if it is, it's so ineffective. So they got it all, and the way they did that was by spending $1.4 million a day in lobbying. $1.4 million a day. Thousands of lobbyists have descended on Congress. So when Obama talks about these folks, they've been a part of the process right from the beginning. It's completely untrue. Pharma had a checklist, the Pharmaceutical Research and Manufacturers Association. What they wanted, and they got right away, we didn't find out about it till later, they had a closed-door meeting with President Obama to make a deal to protect their profits. Gilly Towson got a meeting with him, and they made a deal that they would give $80 billion in savings, which of course now have been negated because they've raised their prices before reform is even going to take place, which is 3 or 4 years from now. So they've already negated essentially the $80 billion in savings they would give us. Thank you. There won't be any drug reimportation from Canada or abroad. It's in the Senate bill, but they're going to get, I have no doubt they're going to get that out. They got patent protection for biologic drugs. Biologic drugs are probably some of the most important drugs that have come out of the, well, actually the government, and we fund most research for drugs. These are enormously important drugs. They got more patent protection than they already had. There will be no negotiating drug prices for Medicare Part D. And that is in direct violation to what President Obama said when he was candidate Obama. He said, this is a travesty. We are going to bargain for Medicare Part D. What's happening to seniors is unacceptable. That went out the window, probably in that private meeting in the White House. And then the U.S. drug market will continue to be the most profitable in the world. It's the most profitable market in the world because the government doesn't, with a few exceptions, negotiate for drugs. So they got it all. They got check, 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 check. And from the beginning, we knew there would be no fundamental reform because Obama welcomed the insurance industry and pharma into all of the round tables, all of the photo ops. Karen Ignani was there, Billy Towson was there, all of the heads of these corporations were there, and they kept us out, right? They kept out Physicians for a National Health Plan. They kept out the California nurses. Every single payer group pretty much was kept out. PNHP ended up getting in, but I'll come on to that in a little bit. So basically, Obama lied when he said that everybody would be at the table, and he said that numerous times. I want everybody to come in and talk about it. This is going to be transparent. And somebody told me the other day, the Associated Press actually filed a Freedom of Information Act to find out who has been visiting the White House the most since Obama's been in office. It's the pharmaceutical industry and the insurance industry. And then there's Andy Stern from SEIU. Those are the 3 top ones. If they're doing a lot of visiting and lobbying, it shouldn't come as a surprise. Obama said at one point, he wanted to televise the reform process on C-SPAN. And I haven't seen it on C-SPAN. Not that you can watch it, but it's really boring. Anyway, so the secret meetings, Ted Kennedy had them, Harry Reid, all of them have had the secret meetings. Max Baucus has taken more money from the health insurance industry than any other member of Congress. And so he's charged with leading it's obvious. I mean, the cynicism. I mean, they think the American people are stupid. It's bullshit. I mean, that's why over 50% of people don't support the Senate bill. People know what's going on. And so Baucus is the point man. Elizabeth Fowler, is Baucus's chief health advisor. She was a former vice president of public policy for insurance giant WellPoint. She helped, and I put that quote, helped to write the Senate bill. I mean, it's obvious, right? And then, of course, Nancy Ann DeParle, the healthcare czar, she took $5 million from the insurance. So they're all working together. And when he says in his message to me, not this time, we've come too far, it's completely empty rhetoric. Now, the industry had a strategy right from the beginning when we came up on this round of healthcare reform, and they had to, because the depth of the crisis is so stunning, right? The hatred of the insurance industry. It's probably the same as it is for the tobacco industry, possibly worse, because smoking can be enjoyable for some people who like to smoke. And then all of the healthcare horror stories. Every single person in this country has a healthcare horror story. They've been a victim themselves or they know somebody. So they couldn't do it the way they did it last time with Clinton. And I've got this quote from Wendell Potter. Wendell Potter was the vice president of Cigna for almost 20 years. And he has come out now as a whistleblower. And he knows all the industry tricks. He invented them. You know, he created the spin around sicko, all the lies around it, and so now he's a repentant whistleblower. And I heard him speak a couple months ago, and this was at the PNHP national meeting, and the first thing he did was he apologized to all of us. He said, I'm so sorry for what I spent my career doing, and now I want to spend my time on doing it. He said, we forgive you, Wendell, you're really helping us out, you got to keep helping us out. So this is what he said about what's happening, about the insurers. He said, they know they had a very big public relations problem, and they knew this day was coming. They knew they had to be perceived as coming to the table with solutions. It was a departure from their previous point of view, but they knew they would be slaughtered if it weren't. And I think he's absolutely right. They had to do it differently this time, and they did it, and they're doing it. They're not trying to kill the reform. They have been able to shape it to continue to make lots of profits. And so the Democratic Party, right, the party in power now, they're a capitalist party, and that goes for the Progressive Democrats who sold out and passed the Stu-Park Amendment, right, in the House bill, which has been taken out of the Senate bill. They're a capitalist party, and so they believe that healthcare is a commodity that should be in the marketplace, and it's a party that is funded by big business. And as I said, they take lots of money from the insurers. So it shouldn't come as a surprise to people, although I know it does.